Hey, what's up? Barnaby here. So you want more information about ADHD and the diagnosis of it? Well, perfect person to talk to, Dr. Jeffrey Chamberlain, who is a family medicine specialist. Quickly, give us a thumbnail sketch. What would ADHD, some of the symptoms, what are they?
Okay. So hyperactivity symptoms, trouble staying still, you're moving around all the time, fidgeting all the time. Then there's impulsivity issues with the hyperactivity where they do things like run out in the street without really thinking about the consequences. Then there's the attention deficit, hard time paying attention, changing focus from one topic to the other, more so than other people of the same age group.
Yeah, because really it seems like every 6 and 7 and 8-year-old I know suffers in some measure from all of that because they're just trying to figure stuff out. So how would we diagnose this?
Okay. So what we need to look at is, are these symptoms present to more of an extreme than other kids the same age? And so really we need to compare other kids of the same age group. We also want to make sure they're in different environments. Do they have these problems at school and at home? If they only have it at home but not at school, maybe there's something else going on, or only school but not at home, maybe there's something else going on. But if it's across the board, they have the same issues going on everywhere, that's a good way to indicate, hey, there's something going on, and we need to look into this further. There's formal criteria, and the formal criteria can diagnose you with the attention deficit or hyperactivity or a combination of both. And so it's really having a clinical specialist who deals with people with ADHD, kind of reviewing everything, saying, okay, do they have these issues at home, do they have them at school, and do they meet the criteria for ADHD?
Well, it seems that by my experience talking to people with kids of that age, the school tends to look at it, they say, I think I know what's going on here, and they become almost like the gatekeepers. But would you recommend taking that information as a parent and bumping it up, go through your family physician, maybe go to a specialist?
And that's what I do that. I send my patients with a new diagnosis of ADHD to a specialist. I can diagnose ADHD in my office by looking at the criteria and getting surveys from the parents and teachers. But what I can't very accurately do is look for other problems that might be going on that makes things look like ADHD. Your question, is there a hearing problem? Is there a vision problem? I had one boy who was in 6th grade, and a teacher said he has ADHD. Mom said he had ADHD. I wanted to send him to a specialist, and Mom got mad at me. She stormed out of the office.
Really?
Pretty upset with me because she knew he had it, wanted to put him on medication, but I wanted more testing.
Right.
We got the testing. Turns out he barely met the criteria for ADHD, but he had some severe learning disabilities. He was in 6th grade, but he had 2nd grade math skills, 3rd grade reading skills. And what he was doing is he was screwing around in class in order to mask the fact that he didn't know these things. And no one knew this. The teachers never picked up on it. Mom never picked up on it. And she actually came back to me and said she was incredibly happy and so thankful that I made her get this testing done. Because if we didn't do the full testing, we would have missed that. And how long would we mess around with medications before we figured this out?
Well, I think it's always best before you start putting medications into a developing body to make sure you know what the problem is, right?
Exactly, yes.
Yeah, all right. Well, that's good information, and you're in the right place for just that because you searched out ADHD. You found us at HelloLife.net, and we invite you to stop back often because we will be a wellspring of good information for you about all things health-related. Thanks a lot, Doc.